The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back, Shifties, to the next episode of The Shift. I am so thrilled and excited today to have a really special guest, Dr. Rachel Kermis. I'm going to call her Dr. K moving forward. She and I met about 2 years ago, had this immediate connection as it relates to creating healthy work environments, what burnout looks like, feels like, sounds like. And I'm just thrilled to have a friend of nursing on the show.
I'm so glad to be here, Andrea. I always tell people I would not have gotten through residency. I would not have become the person I am today without the nurses in my life. So they are, I think, an essential part of our care team. And I worked every day I can just to help support them and make it a collaborative environment. So really excited to be here and help show that us docs are advocates for nurses, and excited to talk about ways that we can make our overall healthcare workplace and workforce better. My background, I'm a family medicine doctor. Actually, ever since I was 3, wanted to be a physician. I had little tiny blue scrubs because I was sick with a lot of health problems in and out of the hospital, which again introduced me to those wonderful caring nurses that just showed me that there is humanity in medicine. Um, and eventually became a family medicine doc because I wanted to build that rapport with my patients. Um, Ended up moving to Louisiana, where I felt that there was a big need for primary care and kind of increased awareness and education about those chronic health conditions. And that's where I've been practicing since. But I've had a bit of a pivot in my path due to the great transformer of life as we knew it, COVID. And we know COVID really made everything switch around from, hey, we weren't seeing our loved ones as much to, yay, technology. Technology is here to stay. We got wonderful advances in it. And then, of course, like, how do we deliver healthcare because of COVID? And that kind of led me to my journey where I am now. I currently serve as assistant medical director for value-based care clinics as part of Ochsner Health System, which is a big health system down in Louisiana.
Oh, yes, I'm very familiar with that. It's
Yes.
wonderful. Let's talk a little bit about um, the relationship of nurses and physicians and how building and sustaining that relationship is number one, obviously important for the patient experience and the patient outcomes, and number two, how it can help decrease burnout as burnout's such a hot topic. Even our Surgeon General put a call to action.
Um,
So talk to about a success story and a not success story.
Yeah. So I think the success story I'm going to share is one of my dearest friends now. Her name is Callie. She and I met when I was a resident, and I was on my internal medicine wards, and I had a patient who was just crashing. I knew something was wrong. I knew we had to do something. I didn't have my upper level really listening to me, and then she came in. She helped advocated. We got this patient the care they needed to a safe place. We solved their problem, and it was just like amazing that we could work together. And she knew kind of more of the ins and outs of the hospital than I did. And I was like, oh wait, like, Kelly's gonna help me fix it, and it worked out great. And then since then, I've talked to her about multiple different cases to get her perspective of, hey, like, how would you approach this? Because I find nurses sometimes do focus more on that social aspect of care that we docs put blinders onto, where we're much more, oh, let me go through my review of systems, and now I know you have diabetes, and now you're the diabetic patient. You're not Mrs. Smith who has a really cute dog and 2 grandchildren that she wants to go home and play with. So I think that has being around people like Callie have just helped me grow my empathy and my like holistic view of the patient. And in my current role, one of the things I'm working on focusing on is how do we get an actual care team in place to help work with our patient? Because it can't just be one person leading it. It has to be everyone working together and using kind of our different strengths and our different viewpoints to really give those best outcomes possible. And as part of this care team, we have RN care managers, and they are, oh, I can't say enough about how much they help us and make sure nothing gets slipped through the cracks. So really, and I'm finding that that's helping my docs, one, know the patients more, and also that they have this trusted circle to rely on. So people's emotions tend to be kind of calmed down a bit, and there's better like closed loop communication because we all work together and foster that team environment.
Do you feel like, Dr. K, when there's not that good communication, that good trusting relationship with the care team, that contributes to burnout?
Definitely. I think one, when the patient doesn't trust us, that is a big issue, but also when there is a weird dynamic among the different players on the team. And I don't want to be rude by bringing it up, but I think there's sometimes an unfortunate relationship between physicians and nurses, and kind of a strange power dynamic. And as we look to how many people are leaving the healthcare workforce, we can't keep fighting against each other. We need to find a way to work closer because or else there's not going to be really anybody left. And then when we get sick, which is inevitable, that's just how the human body and life progresses, we're not going to have anyone take care of us. So yes, I definitely think if we don't work to foster this inter specialty relationships, then the outcomes are pretty terrifying, not just for the patients, but for us as like a society.
I agree. And I think, I mean, we could talk about a lot of subjects like psychological safety. Do
Mm-hmm.
nurses
Yep.
feel safe to speak up when they see something not going in the right direction with the patient's condition? And the other thing is, I was just going to ask, I was an intensive care nurse, and often
Yeah.
nurses would lead the bedside rounds. So I don't
Correct.
know if you've
Yep.
seen that in your environment.
So we actually are having our RN care managers lead our daily huddles. So we're taking that idea of inpatient. So that is the one thing I liked about inpatient medicine was that we had this good time. Everyone in the morning, you briefly say hi, how's your day going so far? We talk about the patients, prioritize the day. I was like, this works pretty well. So we are now implementing that in our 65 plus clinics across the South. And I find that once you get to know the other entity you work with as a human being, the trust is a lot better. And if you kind of set up this safe place that we might be talking about good things or bad things, you don't have as much of a sense of panic when you are like, oh, wait, now Dr. Kermis wants to come talk to me about a patient. What did I do wrong? It's like, no, like I know she wants to hear the pros and cons of what the treatment plan is. So setting that groundwork of let's know each other, let's set this communication really and get it in stone beautifully, we need to focus on a lot more.
Many years ago, I was an interim nurse manager in the surgical, actually was at this time, it was the medical ICU. And every month when the new residents would come through,
Mm-hmm.
I started this, I don't want to call it a program, but all the new residents would come through and have to meet all the nurses, and we'd all
Yes.
do like a quick fun fact about each other just from the
Oh,
very beginning so that we could kind of humanize who we are.
yes. So
And
now I
I'll
have to ask you, what was your fun fact?
My fun fact is I've tried 3 times to learn Arabic and I still can't do it because it's a really
Well,
hard
it is a very hard language, but I am impressed that you have tried 3 times. That's awesome.
3 times.
Very cool.
And what's interesting is one of our residents he spoke Arabic, so he and I had a really great connection. But these little hokey things, if you will, create
Mm-hmm.
meaningful connections in the clinical care delivery environment that are
Mm-hmm.
critical for patient outcomes and critical for trust and decreasing all these signs and symptoms of burnout that are just so prevalent across the globe in any care environment. Um, Tell me about a time where there was there wasn't success. I don't like to use the word failure, it sounds negative, but there was not a
Yeah.
success because the team was not collaborating like they could have.
Yeah. So probably, let me think, because there's a couple instances where it just the communication broke down and then we it didn't lead to a longevity of like that care team, because there wasn't that trust there, and there was kind of uh, because people weren't talking to each other, a lot of assumptions were made, and I think that just goes back to show like if you have a concern or you have thoughts on something, put it out in the open so we don't go and make it a worst case scenario in our mind with it. And I would say probably I'm going to use it when I was a patient actually. And because again, going back to kind of what drove me into medicine, I had a lot of different health problems growing up. They didn't quite know what was wrong with me. I eventually had to go to the Mayo Clinic, and they did a bunch of tests and finally got diagnosed with an immune deficiency. But through that process, I had a doctor and a nurse where they were trying to explain a test to me, and I had had it done before, and I knew it was a painful thing. They run electricity through your arm to see what the sweat contains, basically. And the nurse was trying to say one thing, and the doctor was trying to say something else, and all it did was make me more and more panicked about what was going on, and like, hey, these are the people taking care of my life, and if they can't agree on it, how do I know it's the right thing? Because again, growing up, I had these wonderful nurses who had helped coach me through things, and now the doctor and her were not visibly like very visibly not agreeing. So it just raises that level of distrust and then the anxiety associated with whatever procedure that patient might be going through. And I think what could have made it better is let's come up with a plan before I went in the room with this kid who clearly had been exposed to a lot of different stuff based on this pack of papers I brought in. And like figure out that agenda of how are we going to help her the best and not lose sight of the fact that like our patients are almost our customers and we want to have that aligned front to them. Because it really, I mean, motivated me to not want to ever be in that situation when I was then giving care to patients.
The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout. Increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk. As a nurse of 30 years and then having a twin brother who passed away from cancer, so you're on the other side.
I'm sorry.
Thank you. And it's very different.
Mm-hmm.
If we could share with the shifties that are listening to us today, a couple words of wisdom on how to build those relationships, what would that look like? What would that sound like? So for me as a nurse, I would say to nurses that are in the clinical care delivery environment, don't be afraid to speak up, but make sure you do it in a way that is really, you're exercising humble inquiry, so that it's just humble in the way, because with what we don't want, and I saw this in the ICU, there were some very incredibly brilliant intensive care nurses who thought when residents came in, they're only there for 30 days. Oh my gosh, I know way more than they do. They're not going to tell me what to do. And you could almost visually, and you could see it and hear that there was already some egotistical tension going on. So I think my words of wisdom is always exercise humble inquiry, because I promise you, everyone can learn from each other.
Definitely. So I guess speaking from what I try to have people do is if you don't know something, it's okay to ask like for help and to say, hey, I'm not sure how to do this. Can you give me the training or can you talk me through it? And I know that's how I've learned a lot of the ways that we've improved some of the operations in our clinics is from me going through and saying, I'm not quite understanding what this barrier is, but I can see it is one. Can you talk me through why you're having difficulty completing this outreach or following up on these referrals? And like by seeking to understand someone's position and showing the vulnerability and like I mean, as someone who's assistant medical director, to go in and admit I don't know something, especially being a young female, it takes a lot to put that guard down. But I find when I wasn't being my true authentic self of like, hey, I don't know this, I want to know it, um, people were interpreting me the wrong way. Definitely was coming off in a way where, hey, she knows everything and she's not listening. And in me, I was doing that because I thought I had to put on that front because that's what was expected. And it just was not accomplishing the goal of solving whatever problem we were working towards. And so I would encourage any physician or any sort of leader to, if we're hearing that our staff or our teammates are having an issue with something, we have to try to figure out what we can do to understand it better and then work to like kind of find that happy medium between everything. And then my second point, I encourage everyone to do this, whether it's my patients coming in or a random person I meet on the plane who I'm giving a motivational pep talk to. You got to find your purpose in life and your why. And I think with our care teams and nurses, like, you are such a wonderful part of it, and you know your patients so well and you advocate for them so well. I want you to kind of treasure that and share that with other people when you know, hey, you're proud of this patient for accomplishing something. Like Mr. Smith just ran a 5K. Look at him go. Like that joy and that sharing that knowledge of someone else and those patient stories makes us all connected. I personally keep a little notebook of good stories and outcomes or things people have said from my time seeing patients. And when I was having really terrible days, because sometimes that happens, you're just like, I don't know what I'm like, why am I doing this? What is this world of medicine we're having to practice in? I could read those and see, okay, I did make a difference in this situation. And I think do that for yourself. It's not, you're not being bragging or humble bragging if you share it with other people. Like this connection is really going to help us kind of discover that joy of practicing medicine. And I agree with the part that you mentioned about asking questions in a humble way, or because that's how we all make sure we're on the same page.
I love everything. And you said some really key words. Be vulnerable, be your authentic self.
Mm-hmm.
And these are the things that create meaningful connections. And I think that's why you and I connected so well. I think we're both authentic and I think we're vulnerable. And I think it's okay not to know everything.
Yes. No one can know everything. Like even if we look at ChatGPT, which is supposed to know everything, like you still have to train it to know things. So if the wonderful, brilliant AI computer can't do it, like how can we as individuals who are in this ever-changing world? And I mean, think about how much medicine has shifted from 4 years ago to now. And it's amazing that we've come as far as we are. And there's no way anyone can know it all. And just the only way we can is by using other people as our strength and our resources. So don't be scared to reach out and ask for help.
I love it. Dr. K, I can't thank you enough for your energy. I just love your energy and your authentic self. You're incredible. And I hope that you'll come back on the podcast and we can talk about next time you pick it. We'll figure out something really interesting to talk about. And I just always want to remind all the shifties, your shift makes the difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.